My name is Mark Schaefer, Vice President of System Innovation and Financing at Connecticut Hospital Association. We appreciate this opportunity I appreciate this opportunity to testify concerning House Bill 5320, an act concerning hospital financial assistance. CHA opposes this bill. Connecticut hospitals strive to ensure that the inability to pay for services is not a barrier to seeking medical care. And it's why they work hard to ensure their financial assistance policies are applied to all those who are eligible and to connect eligible uninsured patients with a regular source of health insurance coverage. CHA's primary objection to this bill is that it's largely duplicative. Section 1 of this bill focuses on financial assistance for individuals enrolled in SNAP and WIC, regardless of immigration status. All Connecticut hospitals already provide free care or financial assistance to uninsured individuals who fall within the income requirements of this program, these programs, regardless of immigration status. Section 1 also requires that hospitals use a uniform application for financial assistance. In addition to offering free care for low-income individuals, hospitals may offer a range of financial assistance programs to help patients cover their medical expenses. And these programs vary from hospital to hospital based on the kinds of donations they may receive to cover such services or programs, and typically have specific requirements regarding who qualifies and the criteria for eligibility. And these may vary from year to year. So an application that took into consideration all such requirements for all hospitals would be difficult to maintain because the programs change. And it could also require the patient to complete a much longer and more burdensome form than they do for an individual hospital today. The bill also imposes unnecessary and burdensome reporting requirements that add to hospitals' administrative expenses and ultimately the costs of care we all bear. Finally, the bill authorizes the Attorney General to investigate the application of hospital financial assistance policies when these policies are already subject to the oversight of the Office of Health Strategy. CHA will continue to focus on hospitals' efforts to make their financial assistance programs as easy to access and navigate as possible, raise awareness about these programs with patients, and ensure that hospital staff remain well prepared and trained to articulate these policies to patients. Thank you for your consideration of our position.
Thank you so much for your testimony. So can I clarify, so the CHS position is even the universal form is not acceptable?
Yes, and talking with our members, there are beyond simply the free care that they all offer for uninsured individuals below 200% of federal poverty level, or in some cases 250%. There may be special unrestricted donor funds or restricted donor funds, for example, that might support a particular medical assistance opportunity or financial assistance opportunity. And so the application forms are designed to help identify folks who might be eligible for more than just the basic free care or financial assistance that they would otherwise be entitled to.
So, Mark, what are the things you guys like about this bill?
I think there isn't a provision in this bill that we're voicing support for because we believe that the hospital's free care and financial assistance policies are actually some of the best in the nation. And that's also in part because the statutes in Connecticut are much more protective of individuals around things like liens, for example, so in Connecticut, we think we're in pretty good shape, even despite the fact that without question, medical debt is an issue, but that's a different set of problems requiring a different set of solutions.
Thank you so much. This is very helpful. I would just say that the issues are real, and the people who have come and spoken, they do have very valid issues that they are trying to bring to the table. And the hospitals do have a role in the picture. We just have to look at what is the way to find a way to move forward and address some of these issues that we can. The idea is also not to make it too burdensome from a logistic point of view for the hospitals, but at least we should have a mechanism to address the medical debt and some of the other challenges.